Welcome to our in-depth exploration of hydration, a subject that touches every aspect of our lives, yet is often misunderstood. Did you know that both drinking too little and too much water can pose serious health risks? Today, we invite you on an educational journey, one that will reveal the intricate balance our bodies require to function at their best. In the next 17 minutes, we will uncover the contrasting states of dehydration and overhydration, examine the causes and symptoms that define these conditions, and highlight the potential risks they pose to your health. As we walk through this narrative with a calm and deliberate pace, you will gain a clear understanding of the importance of maintaining the proper hydration that is essential for optimal body function. Let us begin with the fundamental concept that water is the essence of life, a vital resource that powers every cell, every organ, and every moment of our daily lives. Water is crucial because it enables every system in our body to perform the tasks necessary for life. Cells depend on water to transport nutrients, remove wastes, and maintain chemical processes, while organs like the heart, kidneys, and brain rely on hydration to operate effectively. When we speak about hydration, we are referring to the body's balance, a finely tuned system that, when disrupted, leads to either dehydration or overhydration. Both imbalances can cause severe complications if left unchecked. This discussion is designed to empower you with the knowledge required to protect your health and optimize your daily water intake. Over the next part of our journey, we will first delve into dehydration, a condition that many of us experience more commonly than we might realize. Let's now focus on dehydration, the state that occurs when your body loses more fluids than it takes in. Dehydration is not simply about feeling thirsty. It is a condition that can disrupt nearly every bodily function if water is not replenished appropriately. Picture your body as a delicate network of systems, each relying on a steady, measured amount of water to perform tasks like regulating temperature, lubricating joints, and even maintaining blood pressure. When you skip that extra glass of water during a busy day or push your body beyond its limits without proper fluid replacement, dehydration can set in. This condition does not happen overnight. It evolves gradually, and its signs can be subtle initially. However, as water levels drop, the stress on your body mounts, leading to an array of symptoms, health risks, and serious complications. Dehydration can be caused by various factors and circumstances. Additionally, significant fluid loss may occur from sweating during hot weather or intense physical activity, or through conditions such as vomiting and diarrhea, which rapidly drain the body of its fluids. Certain medications increase urination, further contributing to a deficit in hydration. The body loses water in ways that might not always be noticeable until its critical functions begin to suffer. For instance, when you work out in the heat without adequately replacing your fluid loss, hints of dehydration can appear in the form of dry skin, muscle cramps, and even a puzzling headache. In extreme cases, severe dehydration can lead to more dramatic and dangerous conditions such as heatstroke, kidney stones, and electrolyte imbalances that, if untreated, could result in seizures or even organ failure. It is vital to understand these warning signs to take preventative action before reaching the point of serious harm. Look closely at the early indications: thirst, fatigue, and dark-colored urine. These signs might seem benign, yet each one is a critical message from your body, urging you to stop and listen. When the kidneys, which work tirelessly to filter and expel waste, do not have enough water to dilute toxins, their workload increases, and the risk of stone formation and kidney complications rises. Moreover, dehydration places additional stress on the heart, which must pump a thicker volume of blood, potentially precipitating issues such as reduced organ function and circulatory collapse. In children and older adults especially, a seemingly minor lapse in water intake can quickly escalate into a crisis. Dehydration in infants may present as dry mouth and sunken eyes, and in older individuals, confusion and dizziness are particularly concerning symptoms. It is an evolving state where the lack of water can slowly undermine the body's resilience, leading to an overall sense of weakness and disorientation. Throughout our lives, we encounter moments where dehydration can sneak up on us, particularly during long periods of physical exertion or in environments where water is scarce. Imagine hiking on a hot summer day, each step a reminder of the heat, your pace slow, and your body gasping for the relief of water. Even without extreme exertion, daily routines in air-conditioned spaces can mask an underlying need as your body silently loses hydration in its routine metabolic processes. You might feel a slight fatigue or a tinge of dizziness, signals that it might be time to pause, drink a glass, and restore the delicate balance that your body relies on every second. As our conversation unfolds, keep in mind that dehydration, while common, is not an inevitable part of everyday life. With understanding and proactive measures, we can maintain a healthier equilibrium in our bodies. Transitioning now to the other side of the hydration spectrum, we arrive at the topic of overhydration, or water intoxication. While dehydration steals away critical fluids that our body desperately needs, overhydration fills your body with more water than it can process. This might sound counterintuitive. How can drinking too much water be harmful? The answer lies in the delicate balance of electrolytes, particularly sodium, in our system. Sodium acts like a messenger, facilitating nerve impulses and muscle contractions, and when its concentration is diluted by too much water, the body's normal functions can falter. Overhydration disrupts the natural equilibrium of electrolytes and can lead to a condition known as hyponatremia, which has its own set of symptoms and risks. In our discussion on overhydration, we will explore how consuming excessive water leads to an electrolyte imbalance, how the symptoms manifest, and why this condition deserves as much caution as dehydration. Overhydration is most commonly associated with scenarios where individuals intentionally or unintentionally consume water in amounts that far exceed their body's requirements. Endurance athletes, for example, sometimes drink large volumes of water during prolonged exercise, attempting to ward off dehydration, but inadvertently set themselves up for an electrolyte imbalance. Additionally, patients with kidney or heart conditions may face challenges in excreting large quantities of water, making them vulnerable to this condition. The body's natural mechanism for maintaining hydration involves not only the sensation of thirst, but also internal signals that adjust water absorption and excretion. When these signals become overwhelmed by excessive intake, the consequences can be severe. The excess water dilutes blood sodium levels, impairing cellular functions and triggering symptoms that range from mild nausea and vomiting to severe headaches and confusion. In extreme cases, the swelling of brain cells due to low sodium levels can lead to seizures, coma, or even death. A stark reminder that overhydration is a serious medical condition. Imagine the confusion inside your body when its carefully orchestrated balance is disrupted. Cells that rely on a precise concentration of electrolytes suddenly find themselves in an environment where water has overwhelmed the natural chemical equilibrium. The initial triggers of overhydration, nausea, and a sense of overwhelming fatigue can quickly spiral into more alarming issues. Muscle weakness, cramps, and swelling become vivid manifestations of an underlying deficiency in sodium. Clinical cases have documented instances where individuals, especially during marathons or long endurance events, experience life-threatening symptoms as a direct result of overconsumption of water. Hospitals often treat these cases with urgency, highlighting the need for a balanced approach to hydration rather than a simplistic, more is better attitude. While water is indispensable, its role in our system requires a careful synchronization with electrolytes to support every cellular function. The intricate relationship between water and electrolytes is a lesson in moderation. Maintaining proper hydration means more than just quenching thirst. It is about understanding the body's complex needs. The early symptoms of overhydration might be deceptively mild, perhaps a slight headache or occasional nausea, but they serve as warning signals that should not be ignored. Recognizing these signs in yourself or a loved one is crucial in preventing more severe complications. Your body thrives on balance. In the coming section, we will discuss practical measures to help maintain that balance. We will explore recommendations for daily water intake, clarify how to monitor your hydration status effectively, and offer actionable tips that can be implemented into your everyday routine, regardless of your physical activity level or medical background. The key to ensuring proper hydration lies in customization. Not everyone's water requirements are the same. Factors such as age, sex, climate, and physical activity dramatically influence the amount of water your body needs. The Institute of Medicine suggests that a healthy adult should consume approximately 78 to 100 ounces of fluids per day, roughly translating to about 9 to 13 cups. However, these figures serve merely as a general guide. Your particular lifestyle and health circumstances may require adjustments. Perhaps you live in a hot climate that accelerates water loss through sweat, or maybe you engage in intensive exercise sessions where hydration needs increase sharply. The principle remains: it is essential to listen to your body. By monitoring cues such as the color of your urine, pale yellow indicates proper hydration, dark yellow suggests dehydration, and completely colorless urine may signal an excess, you can gauge your hydration status with ease. Practical advice for maintaining a healthy balance includes a series of actionable steps. First, cultivate the habit of drinking water at regular intervals, rather than waiting until extreme thirst sets in. Integrate hydration into your routine by keeping water accessible, whether at your desk, in your car, or during your workout. Second, consider supplementing plain water with fluids that contain essential electrolytes, especially after strenuous physical activities or when you are exposed to prolonged heat. Consuming beverages with a balanced mix of sodium and other minerals can help maintain the chemical equilibrium that your body needs to function optimally. Additionally, pay attention to your diet. Foods rich in water, such as fruits and vegetables, contribute significantly to your overall fluid intake. Items like cucumbers, oranges, and melons not only supply water, but also provide vitamins and fiber, making them an excellent complement to your daily hydration regimen. It is equally important to recognize situations where professional medical attention becomes necessary. If you notice persistent symptoms, such as continuous dizziness, confusion, severe muscle cramping, or changes in urine color, it may be time to consult with a healthcare provider. For individuals with pre-existing medical conditions like kidney disease, heart failure, or conditions that affect electrolyte absorption, keeping a close eye on hydration status is often critical. Early intervention can prevent dehydration or overhydration from escalating into life-threatening emergencies. Establishing a partnership with your healthcare professional and discussing your personal hydration needs can provide a tailored plan that supports your overall health and well-being. Ultimately, the message we want to leave you with is simple yet profound. Balance is the cornerstone of health. The story of proper hydration is one about equilibrium, a continuous adjustment between water intake and the body's need to maintain critical functions. In this way, hydration transcends the basic act of quenching thirst. It becomes a fundamental pillar supporting every physiological process in your body. Through understanding both dehydration and overhydration, you are better equipped to meet your body's dynamic demands. Every sip represents a small act of care that, collectively, sustains your life and fortifies your well-being. As our discussion nears its close, reflect on the journey we have taken today. From the essential role that water plays in every cellular function to the risks associated with both a shortage and an excess, we have explored the complexities that govern our hydration. We have learned that dehydration weakens the body, causing a cascade of symptoms that signal distress, dry skin, fatigue, and confusion that can culminate in severe health crises such as heat stroke or kidney injury. Similarly, We have seen that overhydration, while less commonly discussed, carries its own formidable dangers, such as electrolyte imbalance and the risk of hyponatremia, which can upset the balance of life-sustaining minerals and cause dangerous neurological impairments. In conclusion, the path to optimal health is paved with the knowledge that balance is everything. Hydration is not merely a matter of drinking water. It is about understanding the signals your body sends, recognizing when it is in distress, and proactively managing your fluid intake to suit your individual needs. Whether you are experiencing the subtle early signs of dehydration, the hidden warnings of overhydration, or seeking a way to maintain consistent balance through everyday practices, the power lies in informed decision-making. This informed approach to hydration, grounded in scientific insight and practical guidance, enables you to safeguard your health and enhance your quality of life. Remember this: every drop counts when it comes to sustaining your body's intricate harmony. Stay informed about your body's hydration needs and consult with healthcare professionals to determine the right amount of water for your individual health.